All right, thank you everyone for coming to Demystifying the Cayuse Maze, Navigating the IRB Process. We've gotten a lot of questions just on how to use IRB, what the initial process is, how do you move it through the system. So that's what we'll be talking about today. I do want to be clear from the start that Clara and I are not the IRB. So if you have specific questions about a particular protocol, or if you want larger insight into questions about IRB policies specifically, you should reach out to IRB to ask those questions. You can reach out to them through either this phone number or irb@usd.edu, and they'll be able to address questions with you. And we'll send this out later, but this is the link to the Human Subjects Protection site that has a lot more information than what we're providing today. So you'll have access to that as well. So we're going to talk about just the general process of IRB. And I'm happy at any time if you have a question, please just unmute and interrupt. I did the best in terms of what to present based on some of the questions that got asked. But sometimes when you're talking about this just initial understanding of what a process is, it's not always clear what we need to talk about and what we don't need to talk about. So if there's something that you are wondering or I don't address, please just step in and ask the question. So the first question we frequently get is, when do you actually need to go through the Institutional Review Board and when do you not? So Institutional Review Board, that short IRB is the acronym you mostly hear. Those are IRB review is required for projects that meet the definition of research that involve human subjects, which means that you are looking to do something with people, and that you will be doing some kind of interaction or intervention. So you might be asking them questions or doing a clinical trial or doing an experiment of some sort on human subjects, or you are looking to have access to any kind of private information, particularly when that information is, well, if it's identifiable, like if you want medical records of a person, or if you want their education records, things like that, you will need to go through IRB. So what is research? Research is when you're doing systematic investigation of a question where you're trying to create some kind of generalizable knowledge. So two key terms there. What do we mean by systematic investigation, and what do we mean by generalizable knowledge? So first, a systematic investigation is when you have a research question and some hypotheses that you want to test, or you're trying to build a new theory. So like if you are doing qualitative grounded theory where you're not testing a priori hypothesis, but instead are trying to develop a theory through talking to human beings, that is still systematic. It's still an investigation, even though you're not coming in with preconceived ideas or notions of what you're going to test. And then what is generalizable knowledge? Well, it's a little different than what, for those of you who've taken statistics or know, polling and things like that, and think about generalizability. Generalizable knowledge is a little bit different than that, and it gets a little bit tricky for those of us who are in statistical analyses because we get confused, right? So generalizable knowledge for IRB means that your intent of the project is to basically speak to outside of the group that you're talking to. So if you're doing an evaluation of a program and the purpose of that evaluation is to inform that program so it can prove itself, that tends not to be research, right? That you're not trying to speak to the world outside of that particular program. Instead, you're trying to do something to study that program specifically. That's not going to be research. However, if you want to do an evaluation and you're testing a theory on one specific program that you then intend to say to the world, hey, this is how this theory actually works, based on the study that I did here at this one site, that would be considered research. So it's just like, where are you trying to who are you trying to speak to? The world at large, or are you trying to speak to the program specifically? And you can read the full list of policies and how USD IRB defines these things here as well, so you can follow that link. Before I go on, are there any questions? Because that's a lot. I'll give you an example. I recently got an IRB. So I review all the IRBs for the School of Health Sciences before we send them to the actual IRB. To be clear, I am not reviewing them to determine whether or not they need IRB approval. I am reviewing them for the School of Health Sciences to make sure that we're complying with policies and practices within the School of Health Sciences. And also I help as a guidance, like I help guide, these are the things that you're going to need to do that IRB is going to ask, so that our IRB is in the best shape possible, our IRB requests are in the best shape possible before they go up to the actual IRB, right? So my approval or disapproval has nothing to do with actual human subjects review. But I did recently get a request that's from someone because they wanted to do a literature review. So they wanted to get all the information out in the literature on a particular topic. Is that research, according to this definition? Nathaniel? You're shaking your head.
No, it's not.
Why not?
Because it's already taking what is already publicly available and putting it out there again. It's not private information.
It's okay, Chrissy. And also, what is it not involving?
Human subjects.
Yeah, there's no human subjects involved, right? So you're not analyzing anything about humans, you're not doing any interaction with them or intervention with them. It's pre-existing, available, out in the world. You don't have to have any private information, so it's not going to be a human subject study. So that's something to consider. Now, if this is confusing to you and you do not know whether or not you need to go through IRB, there's a mechanism for that, and I'm going to talk to you about that in a second. First, I want to step back and talk about Cayuse. So Cayuse is the system where we put all of our studies through. It's like the database that we use online that manages all the human subjects requests and all of your submissions for the University of South Dakota. So it's Cayuse. In order to get started with Cayuse, if you want to do any kind of human subjects research, you're going to need two things. You're going to need city training, and you're going to need a Cayuse account. So city training, city is the outside entity that we use to provide human subjects training to all of our researchers. So it is a training set of modules. I think there's like 16 modules. I didn't look for the purpose of this, but there's something like that talks to you about the ethics of research, and it talks to you about confidentiality. Like, it tells you everything you need to know to understand the basics of human subjects research. So you have to take that training and become certified in order to do research with human subjects. Not all universities use city. There are other programs out there that do this type of research, but if you are affiliated with the University of South Dakota, or you're primarily doing research through your affiliation of the University of South Dakota, you should do your city training. If you're working with a partner that has a training from another organization, USD IRB, in my experience, will accept that as long as you have their training certification. I will put that with an asterisk because policies change. As far as I know, they will accept it, but you can always ask IRB. So the first thing you're going to do is go through and do your city training. You will either take group 1 biomedical research or group 2 social behavioral research. I do group 2 because I'm a social behavioral researcher, and I think the majority of the School of Health Sciences will probably do group 2, but you can do either. So if you want to do the biomedical one, you can. So you can do one or the other and complete that. Once you have your city training complete, that certification done, it is good for 3 years. And then every 3 years, you'll get a notification from city that you need to re-up your training. So you'll go and do some short courses. It doesn't take very long to do your recertification. I just did it last month. But you'll need to do that every 3 years. And the next thing you'll need to do is request a Cayuse account. So just by doing your city training does not mean that you'll have a Cayuse account. It is not automatic. The link is under here, and again, we'll send this out so you can follow it. It's really simple to ask for a Cayuse account, and it normally takes about 1 or 2 days for them to get you added to Cayuse. It's not a onerous process. If you are working with another faculty or a student, frequently this happens with students who doesn't have a Cayuse account, before you submit your IRB request, you need to put them in Cayuse. So you need to do a Cayuse account request for all the people internal to USD who are going to be on your project. If you're working with students or colleagues outside of the University of South Dakota, they will not need a Cayuse account. You'll be able to manage application at least initially. Now, if you do have people on your project from outside the university who are like co-Is, like they're majorly responsible for the project and can modify and everything, then USD will frequently create them a Cayuse account, although in my experience, it doesn't normally work well for certifications. And so that's just something, if anything like that happens, just communicate with IRB. They're great at back and forth communication on these kind of questions and can help you get anyone you need registered. So then once you do that, you can go to Cayuse. You're going to, that's not right. Hold on. You're going to land on a page that looks like this. You can see this, right? Okay. So you're going to land on a sheet that looks like, or a thing that looks like this. And you're going to go under products. You'll see there's 3, 4 things down here. I only use 2 of them. This is Cayuse for grants. So for those of you who do grants, who are familiar with grants and have heard Cayuse in that way, this is where we put all of our grants through. We're talking about Cayuse for human ethics, which is here. So you'll go in there. And then it will load. And lately this ignore message has been coming up, so you just close that. So this is my Cayuse for my research. So you can see over here, these are the projects that I have, studies I have in process. These are the submissions that I'm currently working on. And then this is a rundown of at least my recent stuff from Cayuse, the studies that I have. So this is like your dashboard that you'll use in order to go through Cayuse. Where is the PowerPoint? Oh, here. Okay. All right. So I mentioned to you that if you are not sure whether or not you meet the definition of research, what you will want to do is fill out a determination request through Cayuse. It's really easy to do. And in fact, even when I know about 99%, no, this is not research, it's evaluation, I still do this because it's really nice to have the letter from the IRB that says, no, this is not human subjects research, and you don't have to go through IRB because it shows that you went through the steps, particularly in terms of where you have grant funding associated with something. I like to be able to have that just in case it ever comes from the granting agency about human subjects. You can then have the letter from the IRB saying that it's not. So how you do this. So I started this thing the other day to make examples called Do I Need IRB? Let's do this. So you're here and you want to find out if you need IRB. By the way, this is also what you're going to do if you know you need IRB. So this is how you're going to start any kind of request to the IRB to review something. So you're going to go into that new submission, and then you're going to put in the title of your project here. Okay. And then you're going to click check. And it keeps, this error is going to keep popping up. It's just something that Cayuse is doing right now. So you're just going to have to live with it. So you can close that, and it's going to take you here. You're going to go to new submission and put in initial. And then you're gonna go into, you can do edit here, or you can do complete submission here to go into the actual request that you're putting. All right, so I'm gonna show this again, I think later, but I have one of the questions is where do you get templates from? There's a couple places, we'll give you some links in the PowerPoint, but it's really nice to know right in the IRB account itself, when you go into it, you have the consent form templates, and also really nicely, the IRB has provided sample protocols, so you can look at what other people have done, like sample ones, to see how it's done. And then also here are the IRBs. So if you're doing a survey, you can use the survey informed consent. If you're doing something that is not a survey, but another type of human subjects research that's not medical, use this one. If it's medical, use this one. If you're doing research with kids, it's in here. And then you can just go through here and pick which template you want to use. If you ever have a question about what you need in your informed consent or not, you can reach out to Ori. That's one of the things we're here for. We can totally help you with that. And I will say IRB is really great at just giving you, like, going back and forth to make sure that you have what you need in your informed consent. So they will help you with that to a great extent. It just, the better you can get it to begin with, the less time it's going to take you to go through the approval processes, right? That timeline, the less changes you have to make back and forth, right? Because each change creates work for you and for the IRB. So it increases the time on that workflow. So then what you want to do is you are asking for whether or not you need research, whether or not you need to go through IRB, you're not sure. So if you're unsure, you can click yes here, and then this will populate the questions about being not sure that you have to answer. So this asks about funding. Here they just ask you to describe what you're going to want to do, what you're wanting to do in your project. You indicate whether it's for a thesis or dissertation. And then this is taking you through that federal definition of research that I already talked to you about. Do you have a methodology? Do you have hypothesis or research questions? All those things. Yes or no. Is it a quality improvement project? So this is, like I talked to about before, like an evaluation or a quality improvement project where you're working with one organization to collect data in order to improve internally that one organization. Those types of study are not research. So it's asking you specifically, are you doing that type of research? So if only the people in the program are being studied, that's what you click. However, if you're hoping to study that one group to speak to something larger, then you click the other one. And then it asks you about whether or not you're trying to create generalizable knowledge. So that will define that there, and you do yes or no. Are you trying to apply your information to the group outside of your organization? Yes or no there. And then those are the definition of research. So then you indicate whether or not you think it's research. And then you talk about whether or not you want to disseminate or publish the information and where you want to disseminate it to, right? So if you are doing a quality improvement study and you're going to disseminate it to the hospital that you're doing a quality improvement on, you would say, we're going to provide the information back to the hospital. Again, that indicates to me it's not going to be research. But if you're like, yes, we want to go to this big conference and present it so other people can change their hospital systems, then it might start entering into the realm of research. So just the key to this is just to be as honest and transparent as you can so that IRB can make a real decision about whether or not it's research. So just think of IRB always as your partners in making sure that you do the research as well and as ethically as possible. And then it talks about human subjects. Are you doing research with from living individuals? Again, like that literature review, the answer would be no, right? You're not doing living individuals. Otherwise it's yes. And then intervention or interacting with individuals and explaining how, and then anything else you want to tell. So tell them, you put that in there. That's it. And then you fill out the personnel with the people involved in the study. Yeah? No question? Okay. If you know that you need to go through a full IRB, you already know that you are going to have a study that is full human subjects, then you just put no. And then that's going to populate the type of the form that you need to fill out for that. That is not what I want. Okay. All right, so what is the timeline for an IRB review? You need to submit your IRB application by the 25th of each month if you think you're going to need to go to full board. If you are working with any kind of protected populations like children, prisoners, you are going to go for full board 100%, right? So you know that you need to get it before the 25th. If you're asking about things like trauma, most of my research is going to go through full board because we're asking really in-depth information about people's trauma experiences. That needs more protection. We need to make sure that those people are really protected. So there's going to go through a full board review. The IRB meets the second Thursday of each month. So that's why it's on the 25th. The School of Health Sciences always reviews your application prior to the submission to the IRB. So you need to add time for that. When I say the School of Health Sciences, that's me. I review it, so I'm going to need a day or two. I usually get to them within a day or two, but if something's happening, I'm out of the office, it might take a little longer. So make sure that you build that into your timeline as well. Then once you do submit it to the IRB, it may take a couple months to get approval, particularly if it goes to full board, because they're going to be going through all the processes, bringing it to the IRB. There's going to be one person in charge of that, and then it's going to come to everyone to review. And then they're going to come back with questions after that meeting on the second Thursday. Then you're going to have to answer those questions, and then it's going to go back to that board, right? So it's going to take a couple months at least to get through that process. If you're working with the IRB before that, like with Mark or Lindsay at the IRB to make changes to your submission or to your informed consent prior to that 25th timeline, if that goes past the 25th when you're making changes back and forth, it's going to increase the amount of time to the next time they meet. So just keep that in mind on the timeline. Any questions? Okay. So when you are doing the IRB process, these are the information that you'll need, and we're going to go through all of these. You're going to just touch on them and what it means. But basically, when you are actually submitting a full human subject study, you are going to have to know your protocol for how you're going to do your study from start to finish, how you're going to keep the data confidential, how you're going to pay people, what all those processes are going to look like. You're going to have that in place, and how you're going to protect your participants. So really, the IRB is the formalization of a protocol that you already should have in place when you go to fill out your IRB. All right, so information you're going to need. First, study personnel. The PI must be faculty at the University of South Dakota, or you can't, for example, a student cannot be the PI. So if a student is doing a project, their advisor on a dissertation or a thesis is actually going to be the lead PI, and it'll ask for principal investigator. That's going to be faculty. And then other researchers involved from students and faculty at USD need to be added to Cayuse, like I mentioned earlier, and they need to be named as part of the study team as well. You're going to need to describe what everyone's doing on the project and then what training they have in order to do it. One of the questions we got when preparing for the seminar was, well, what if you're working with an external partner on this project? There's a couple ways to do this. If you are working with an external partner who is just providing you access to their population for the research, then they can just write a letter of support for the research explaining how they'll provide access, and then you'll upload that into IRB. However, if you're working with an external partner on the study itself, meaning that basically you are intending to share data, like non-de-identified information about people with people at other institutions, then there are processes you need to go through to get that approved. First, if you are a subaward or if you're a co-I or like just a helper, a research helper on a project, and someone at another institution is going to be the lead, then USD IRB can cede authority to the other university, meaning like when I have a partnership with University of Colorado, Colorado Springs, and they're going to be the head of the project, my friend there is going to be the head of it, and I'm just going to be a researcher on it, then USD can say to UCCS, we're going to cede authority to you. You guys decide what's going on, you control it, whatever. We're just ceding it over to you. In my experience, that's normally what USD has done in the past. Again, asterisk that for policies change, practices change. So that's been my experience. If you're in that situation, you just talk to IRB. You send an email to Mark and you say, I'm in this project with this institution. Here's the contact person for that institution. What do I need to do to satisfy USD IRB requirements? And they can guide you through that process. Now, if you are prime, like if you're the head of the project and you're going to be the PI and you're going to be the one handling it, and it's going to go through USD IRB, then what you're going to need to do is talk to your partners about their university requirements. So some other institutions will just say, we'll just cede authority, which means they'll probably just write a letter that will go, and I don't know what this looks like because I'm not IRB, but somehow they'll say to USD's IRB, you guys do it, you got it, you handle it, okay? Other institutions do not allow that. They require using what's called smart IRB. And I'm going to let Clara talk about that because I've talked quite enough.
Yeah. Yeah, so smart IRB is a system that these universities use in order to communicate between the IRB systems. So if University of Nebraska IRB can communicate with USD's IRB. And I'm actually going to share my screen here really quick. So if you click on the link that is, can you guys see my screen okay? Cool. So in the PowerPoint, I do have a link of instructions of how to get started with Smart IRB. It'll bring you to this spreadsheet or document that talks about just the basic steps of how to get your Smart IRB started. There's also great instructions on the site and a video walkthrough on the site as well. So I highly recommend you check that out when you're going through it, just to make sure you're going through the process correctly. But the way that the Smart IRB works is you as the PI create a request in the system, and then the IRB at the reviewing institution, so USD in this case, goes through that request in the system, and it gets sent over to the other IRB at UNL, wherever, so that way they can approve that request in the system. I don't know how it looks like on the back end when it comes to IRBs, what they're looking at when it comes to the Smart IRB system. But the way that this works, it just allows a back and forth between the two IRBs and a way for them to communicate any changes, any modifications in the projects. So when you go through and create an account, you'll request an account through the Smart IRB. USD will approve that account. And once you log in, you can start a new request. Some of the information you'll need when you do a new request is you'll need to put in details about the study, title, your information, the description of the research, the requesting review or IRB, so USD, and the reason for the request. And then it'll have a spot where you add all the details of every institution that's involved, or every site that's involved. And there'll also be a spot to put all the different research personnel in there as well. So you'll have to put in the name of the research personnel, their email, contact information, and their degree. Once you get everything added and submitted, the information will get sent to USD's IRB, and they will review that information. And then they will route that, once they approve of the Smart IRB, they will route it to the other universities to review and approve. Once that gets approved, they're now connected. So anytime that if there's any changes or updates to IRBs, it'll allow them to communicate back and forth those changes and updates to the IRB. If you have any questions on Smart IRB or how it works, or if you're trying to go through it and you get stuck somewhere, you can email Ori and we can help you kind of through that process, answer any questions you may have. So that's kind of the basics of the Smart IRB. Any questions at all about Smart IRB or anything?
Okay, Claire, are you controlling the PowerPoint? Okay,
Yeah, I am.
all right. So, and just to reiterate, we have several studies now that have had to use Smart IRB, and Clara knows it inside and out. So if you have questions, just please reach out. She should be able to help you, and if she can't, of course, IRB can help you as well. The key to IRB is communication, right? You need to communicate with your partners, you need to communicate to IRB and with all your research partners to make sure that you are doing the study in the most ethical way that is the best for your participants. So everyone is a partner here. Communication is key in partnerships. The second thing you'll need for information is your study details. This is going to ask you information about what type of study you're doing. Are you doing it for a grant? Is it for student research? Those kind of things. And then you're going to have to click through any special considerations. For example, if you are paying participants, that is going to have a whole bunch of implications because if you're paying participants, then you have to be able to track who you paid, and a grants account or accounting becomes involved in that. So you have to click that to make sure that IRB is aware that there's payments going on because of that tracking information needed. And then if you have a special type of participant, like a prisoner, or if it is children, etc., you want to click on that. And then anything else in here that is the case, you would want to click. If you are trying to waive documentation of consent, meaning sometimes there's studies where you don't want people to sign for a variety of reasons, you don't want to have them sign, you would put that on here as well. The second thing you're going to need to do is study type. This is whether or not you're doing a survey, an interview or focus group, or if you're doing some kind of experimental or quasi-experimental design. Analysis of existing data. For example, if you were looking at health records and you were analyzing health records, you would do that, or new biospecimens, or if you're doing some kind of medical intervention. The reason why this is important, because you'll see the menu on the left, what gets populated in that menu changes based on your type of study. They're going to ask you different questions based on your study type. So we'll talk through what you're going to need for the most common types of studies that we see through the School of Health Sciences. Of course, you might have a study type that is like a medical study, and we're not going to really talk through those, but you can see what IRB asks and let us know if you have any follow-up questions for those. So information you're going to need for next is going to be participants, who's going to be in your study. So everything to do with them, from how you're going to get them into the study, whether or not they're going to qualify for your study, how you're going to figure that out, that's all going to be questions that you ask and that you need to have in place prior to starting your study. So for example, if you are planning on recruiting people and you're going to create a flyer, you need to have the flyer submitted. Or if you're going to write an email that you're going to send out to partners, you have to have that email. Or if you're going to have a snowball sampling where you're going to ask participants to tell other people, or you're going to have like community health workers tell people about your study, you should have a script for what you're going to say. If you're having people call you to see whether or not they should be in your study, you're going to have a script for that, like what you're going to say to those participants, so that IRB can see what you're planning on telling them and that it's all put out or all set out. You're going to have your max number of participants. That is a number you can't go over. So if you want to get about 1,000 people, you might put 1,050, whatever. You can't go over that number, and you need to track it and make sure you don't go over that number. If you're going to start going over that number, then you're going to have to do a modification for the number of participants, and I'll talk about modifications later. And it will tell you in the IRB, do not go over this number, like when you're filling it out, so you'll have that reminder. How you have access. So this is where if you had a letter from like a health a hospital or whatever that's going to let you have access to their patients, this is where you would put that, like we have an agreement from these places, they're gonna help us recruit, you put those letters in. Inclusion and exclusion criteria. So inclusion criteria is like who can be in your study. The biggest mistake I see here, and I used to make this mistake until it was pointed out to me, is people over 18. I would say people over 18. When you say that, you exclude 18-year-olds. So you want to say 18 and over. And usually that is a very popular inclusion criteria because 18 in South Dakota is the age of consent where you don't need to get parental consent or child assent in order to be a part of the study. So we see 18 and over commonly. Other states have different ages. So if you are working across state lines, you need to make sure that you're paying attention to that. For example, our neighbor to the south, Nebraska, is 19 and over. So if they're an 18-year-old, they need parental consent. And how you're going to determine whether or not they meet your inclusion or exclusion criteria. Frequently, you'll have a screening tool that you'll provide. It could be on a survey that you might ask them questions that screens them for meeting your criteria. Or if they're calling you to be in your study, you might ask those questions. I'm going to turn it over to Clara to talk about flyers because, as I just said earlier, she's the one that makes everything look nice, including my study flyers.
Yeah, I do make everything look nice. I'm very proud of it. So basic flyer requirements, what IRB requires for flyers is listed here. So first thing you need to put is the purpose of the research. What is your goal? What is your aim when it comes to the research study? I personally recommend putting it in as layman's terms as possible. Don't use complex terminology when it comes to this, because when people look at that flyer, they need to know exactly what you're doing. Any basic eligibility criteria, if there's an age, gender, some sort of restrictions or things like that. If someone is required to have some sort of pre-existing condition or something like that, having that on the flyer is necessary. Any time commitments or any other commitments required. If they have to travel or be in person for anything, you need to add that to the flyer. If there's a certain amount of time, if they're doing an interview and it's going to take about 2 hours to do, you need to add that time commitment on there. Any participation benefits, if there is any, this does include if they get any compensation for participating in the study, but if there's any other benefits, such as they might learn something or they might get any other benefits such as that. One thing to mention is if you are listing any possible benefits, you have to present it in a conservative manner. So you can't be exaggerating, putting in big font, participants get $100 for participating or anything like that. You can't bold it in any way. It has to be in line with all the other content on there. Name and contact information of the researchers. That way they can contact if they have questions about the study itself. If the study or if the research is going to be at a in-person location, the location of the study needs to be listed on there as well. Otherwise, if it is going to be all virtual, stating that it is going to be a completely virtual study, what is it? If it's on Zoom, if it's going to be an online survey, mentioning that on there is required as well. If you are doing any placebos of any sort, that has to be included on the flyer as well, and what the definition of placebo is. So if it's one group, if it's an inactive drug or anything like that, you do have to mention the kind of placebo that will be taking place on the flyer. Now, I get a lot of questions of, how do I design a flyer? How do I make this look nice? How do I get all the information on there, but still make it look nice? And unfortunately, it's a bit of a learning thing. You have to almost learn by doing, but luckily there's a lot of different resources available in order to do these types of flyers. Some of the personal things that I always recommend to people is thinking about who is your population, where is the flyer going to be advertised, and what kind of information exactly do you want to portray? So who you're trying to portray to. If you're trying to advertise to young adults versus maybe you're trying to find people in native population or different things like that, keeping that in mind when designing your flyer, so that way it appeals to those populations. A flyer made for trying to recruit people who are 65 and older is going to look very different from a flyer trying to recruit college students, in terms of visual, making it look visually appealing. In addition, I always ask people, where is the flyer going to be? Are you going to be emailing it? Is it going to be on social media? Is it going to be a paper flyer stuck onto a wall? Because that's going to change how the flyer needs to look. When you're looking at social media, if you're going to be putting on Facebook, you have to think about your phone is only about this big, so your flyer is only going to be about this big. So how are you going to get all that information in that tiny square, and how are you going to have ways of them to register or learn more about the study, whether you use a QR code, whether you use a link or something like that. So those are the biggest questions I always ask people when it comes to creating flyers. Another kind of thing I like to talk about is when creating effective advertisements, there's a lot of design that comes into play. And the basic when it comes to design is there's the principles of design. It's called CARP. And it stands for contrast, alignment, repetition, proximity. It's four simple things to keep in mind when designing your flyers. Contrast, making sure that things are you can visually see them. So making sure those colors actually pop out so you can read the text, making sure you're actually able to see what is being read, or pictures are actually visible. Alignment, making sure everything is aligned in one place. It actually, when things are lined up and actually lined up in a good way, then that way it actually has a little more visual appealing and it's easier to follow. Repetition, making sure, if you're doing bullet points, making sure they all look the same. If you're doing a font, making sure all the fonts are the same. You'll have a better visual representation that way. And proximity is the fourth one. When you put things in proximity together, you tend to naturally group them together. So putting information about one thing all grouped together, it'll be a lot easier to read when you have those things grouped together versus having information up here, then information over here, and information all over the place. Those are the kind of basic design principles, just as a little 101 thing. We also created a info bite last year, I believe, about different types of flyer design. And if you have any other questions about creating a flyer, if you need help creating a flyer, if you have a flyer made, but you want some pointers and things, feel free to send them to me or send them to Ori. I also recommend checking out the website Canva when it comes to making flyers. They have a lot of great templates on there that look really nice, and it gives you a nice template just to start off with, so you can add all the information, and it makes it that way you don't have to start from ground zero when it comes to doing flyers. So, yeah.
We're going to talk about that a lot because recruitment, I think, particularly post-COVID, has become very difficult. Things have changed quite a bit. So being able to make sure that you capture the attention of your intended audience is very important and very difficult to do. So the next thing you're going to need is to know your procedures, what you're going to do, where you're going to do your research, how you're going to go through and get the consent, all the steps the participants are going to be involved in, all the surveys, interviews, and tests. You're going to need to explain your research methods to the IRB. Remember that the IRB, particularly the people who run the IRB, are not researchers. The head person's a lawyer, right? So you need to explain it in a way that is generalized, particularly then when you do go to full board, you're going to get a whole bunch of faculty from different across the university that may not be familiar with your method. So just make sure to be very clear. And then if you're going to use a drug or device, you will need to have your informed consent pre-written when you submit it. And again, you have those templates available to you. So a good key to this, if Claire wants to go forward, is to actually develop a manual. So Claire is going to talk about our protocol manuals.
Yeah. So protocol manuals, I like to think of them as everything and anything that you may or may not need to know about the study. I always ask whenever I'm creating a protocol manual is if Bridget or I or the PI were to disappear tomorrow due to one thing or another, and someone else had to take charge of the whole project, what do they need to know in order to be successful? If they knew nothing about the project, what do they need to know in order to keep it moving forward? So everything that you could ever even dream of to be in protocol manual will be in your protocol manual. So I always start it with, who is on the project, what is their contact information, doing a description of the project itself, what are the goals, what are the questions you're going to be asking, as well as the due dates of different activities or your timeline of activities, and then your detailed description of what the process is for your study. This includes any scripts that you're going to have, any surveys, consent forms, recruitment processes, once you actually get all the data, how are you going to store it? How is it going to be analyzed? And how you're going to disseminate it afterwards. Everything that you may possibly need on it will be on there. I have an example of a protocol manual and a template available for you to use. And I'll actually pull up the example one here quick, just so you have an idea of what it would look like. So this is a protocol manual that I made for one of our projects that we're on. So it starts off with a brief overview of the study. What is it going to consist of? It goes through all the different research staff, what their role is on the study, and their contact information. And then it goes through the entire procedure of the project when it comes to recruitment, contacting participants, how we're going to interview them. If you see all of these orange spots here, those are links to all of the items that you will need for the project. I actually create a separate folder with all the appendix items in there. And if I ever have to make changes to those items, I always do it from the appendix, and I don't try to move them anywhere else. So that way this is always updated with the most up-to-date document. So if you have to change the survey for any reason, you change it from the appendix. So that way this is always up to date. And then that way, if anyone ever needs, if you send this to someone and they need find the survey, or if they need to find this consent form, they can just click on the link and it'll bring them straight to the consent form that they need. So this is it's an example. It has, the timeline on there, what each year is going to look at, how you're going to store the data. If you have fraudulent participants for any reason, sometimes if you're recruiting online or via social media, you might get participants or bots that are fraudulent, people who aren't legitimate for the interview. I highly recommend creating a fraudulent participant protocol that you can screen those participants to make sure that they're real people. And that way, so that way if they're legitimate or not, and a process of, if you find out they aren't legitimate, how do you analyze if they are or not, and what is the procedure to verify that they're a real person. So that's the basics of a protocol manual. Like I said, there's an example there, and there's also a template that has all those sections in there, so you can start filling it out when you are creating your project.
And most of those are appendices are things that you upload into your IRB for approval. But Claire is exactly right. Like, what would happen if I was no longer able to do the study? Someone else is going to have to, because it's funded, right? So someone at University of South Dakota would probably step in. But also, to be honest, it's just for me, right? Because I have a memory of not existing yesterday. So it's to remind me what I have to do every time someone wants to become a part of the study. So it just it is also a central way to communicate when you have a large team, to make sure everyone's following protocol and that we stay consistent with what we told IRB we're going to do. Your IRB will also have to indicate your risks and benefits. You should be as inclusive as possible with naming your risks. So even if it's a minor risk that may happen, you should include it. Risk could be anything from, they might be bored while filling this out, right? To I might cause them to be triggered and have a psychological concern, and that's an actual risk for some of my studies, right? So what am I going to do? And then we come up with in our protocol manual, we'll have a protocol for handling participants who need to be taken into either if they screen for suicidality, if we have to then contact law enforcement, or if we have to bring in an advocate or something like that. We've thought through all of those things to make sure our participants are as protected as possible if they're going to step into my research study, right? So you have to list that. Benefits, usually there's not going to be a lot of benefits. You don't put in there money, right? If you're paying them, a benefit is not money. Generally we'll list things that participants will likely not benefit directly, although they'll likely to benefit from contributing to science, or that people have found that if they participate and share their personal journeys, that is beneficial as part of their healing process, because research does show that, and you could put that in your IRB with the citation to that, and you can put that in your informed consent document. But you don't put money there. Money goes on a different part of the informed consent document that you'll put in any kind of compensation, or if you're providing extra credit, you'll put that in as well. If you are asking in a survey or in a qualitative question about illegal behavior, depression, suicide ideation, or things like that that are similar, you're going to want to put in your informed consent document examples of the type of questions that you're asking. If you're asking a survey, you can put the actual question in there. If you're asking a qualitative question, you can put your actual qualitative question prompt in your informed consent document. That way your participant is 100% informed about the type of questions that you're asking and how deep that you're asking them to go to and into these things that could be triggering for them. Because the last thing you want as someone who's doing research in something that can create trauma, or it's about trauma or something, the last thing you want to do is recreate that trauma or re-traumatize someone. So you want to make sure that they are in a place and they are healthy enough in themselves at that moment to make an informed decision that they can participate. The IRB will also ask you if you have an NIH certificate of confidentiality. An NIH certificate of confidentiality is a way to ensure that if someone tells you about participating in illegal behaviors, that you do not have to report that to law enforcement. We have a misprisonization law in South Dakota that means if someone tells you that they've committed a crime and you don't report that you can be held legally liable for being told and not reporting it. However, if you have the protection of an NIH certificate of confidentiality, that means that you can't report it and that you're covered by the federal government for not reporting it. If you have an NIH grant, you immediately have to do a certificate of confidentiality. If you don't have an NIH grant, you can get a certificate of confidentiality. You can actually apply for one to cover your study. Some other funders have something that is similar to a certificate of confidentiality that you would use instead. For example, a lot of my funding is through the National Institute of Justice, which has what's called a privacy certificate. The privacy certificate gives the same protections. And if you have a privacy certificate, then you can't get a certificate of confidentiality. You can't cross like that. But you are able to get one if neither of those things are the case. You can get an NIH certificate. A really good idea is if you are asking people about trauma-informed or trauma things, that you have resources for them. So a lot of times on the informed consent, you could have a 1-800 number for where they can reach out for while they're taking your survey. If you're interviewing them, one thing we do always is provide a resource sheet. Claire, if you want to show that briefly, because we're running out of time. Are you able to pull it up?
Give me 1 second, it's loading.
So this is something that we put together for one of our research studies that has the connections that they can get in different places across the state of South Dakota, and also nationally. There's state and national things in here as well. And we work with our community support providers to put those resource sheets together. Claire, you want to advance?
Nope.
You do need to have a plan for privacy and confidentiality. This is not about the data, it's about the person. So how do you make sure that the person is protected and kept private? For example, if you do a Zoom interview, you need to ask if they're alone, right? So if people know that they're participating, they're not private. So are they in a lone and confidential place where they can't be overheard? If they're not, then you say, okay, you need to get to some place and call me back, right? So they have to be private. You could have a space to interview where they have a different reason for being there, like a public library, as long as you can do it in a room where they can't be overheard. You're gonna also have to have security for your data, where you're gonna store your data that is safe and secure. If you're traveling with your data, lock boxes are good. Those are like physical boxes you can lock. You can use encrypted files. And if you're sharing data across institutions, my suggestion right now is to use OneDrive that we all have access here. Google is currently being something that the university is saying is no longer secure, but OneDrive right now is considered secure, so you can use that OneDrive. And IRB will review and approve you this plan. All right. So after you approved and done your study, every year that you do your study, you're going to have to do a renewal. And that's just an update on where you are in your data collection and analysis, and if you need to continue collecting data. Someone asked about modifications. A modification is if you're making any changes to any of the things we just talked about, you have to submit a modification explaining what the changes that you requested, why you're changing the request, and then uploading the form that you've changed. So if you're, for example, you're changing the flyer, which happens a lot on our studies, we change the flyer, you upload the flyer, and then you have to get a new approved flyer. When you do modifications, you open up your old Cayuse and you just like type in the old boxes. And yes, Chrissy, we'll send this recording out to everyone. When you're doing your modification, you're just in those boxes, those IRB boxes. So a pro tip there is date your modifications, because if you have a big study, like some of the studies we do, you might modify 6, 7, 8 times to make sure that you are knowing where your modifications are at. Closures. When you want to close out your study, you need to follow what you told them you would do for your privacy and confidentiality in order to close out your study. Closures are a larger issue that we can cover here. So feel free to reach out with Ori for any questions. And then incidents. If you have any adverse incident during your study, you do need to report that to the IRB. An adverse incident is anything that you wasn't supposed to happens, or even maybe something that you did expect to happen but hope wouldn't happen, but is in some way can harm the person that was involved. You need to report that. So an example of that might be, we had a person once who was in the study who needed to stop participating, felt the need to stop participating. We did indicate that that was a potential risk, but we still reported it to IRB that it did indeed happen, so they would know. Clara, do you have any other incidents that you'd want to talk about?
If you have, any incidents where you aren't complying with your original IRB protocol. So for example, if something happens where a form goes missing, or a signed consent form goes missing, any of your data goes missing for any reason, that's what you'll have to report that. If you can do your best to get a new signed consent form from the participant, that is ideal, but you'll have, no matter what, you will have to report that if something like that happens.
Last slide, I think. All right, what questions? That was a lot of information, and sorry we rushed at the end, but I'm trying to be aware of your time. What questions do you have that we did not answer? Nothing? All right, I'm gonna assume it's because you received all the information you could ever need. Actually, that's not what I'm gonna assume. What I'm gonna assume is that, you know, if you have questions, you can reach out to Ori, and you can also reach out to IRB and ask those questions directly. We're all here to help you be successful and also protect your participants. So just remembering that we're all here to work together to get the outcome that we want, which is good research without adversely affecting anyone, right? So that's our hope. All right, I'll leave it there. If you do have any questions, please reach out, and have a happy Halloween.